Are you tired? Or is your heart trying to tell you something? I want to begin with a question I've asked many of my older patients over the years. It's simple, but unsettling. When did you last feel truly rested? For many men over 65, the answer is, I don't remember. But here's the thing, this kind of tiredness, it's not about staying up too late. It's not just about age. Sometimes, it's something far more serious. My name is Dr. Thomas Whitaker. I spent over 40 years caring for older adults, men and women, who taught me the meaning of strength, quiet endurance, and the courage it takes to grow old with dignity. And today, I want to tell you a story. One that stayed with me, because it could happen to anyone. His name was Leonard. 70-2. Retired postman, widower, lived alone with his dog Charlie. Leonard was the kind of man who never complained. The kind who'd rather suffer in silence than make a fuss. He came into my clinic one morning, mostly because his daughter had begged him to. "I'm just tired, Doc," he said with a shrug, probably not drinking enough water or something. But it wasn't just tired. Leonard had stopped going on his morning walks. He'd fall asleep on the couch in the middle of the day. And when his grandson asked him to come toss a ball in the yard, he'd say, "Maybe next time, buddy. Grandpa's a little winded." That wasn't the Leonard I knew. I looked into his eyes that day, and I saw something most people would miss. A dullness. A slow, stubborn weariness that didn't quite fit. We ran some tests, and what we found wasn't dehydration. It wasn't aging. It was heart failure. Caught just in time. Now, I want you to pause here, breathe, and ask yourself, have I been ignoring my own fatigue? Because Leonard almost did. And if his daughter hadn't insisted, if he hadn't come in that day, he may not be here now. This isn't a story to scare you. It's a story to awaken you. Because when you're over 65, fatigue can be your body's quiet cry for help. It's a sign you deserve to listen to. And in a moment, I'll walk you through exactly why. Because aging isn't the end. It's the call to start caring for yourself better than ever before. Let me tell you something I've learned after decades of treating older adults. The heart doesn't shout, it whispers. And fatigue is one of its earliest whispers. So what exactly is going on inside your body? When we talk about heart disease, especially in people over 65, we're often thinking about things like heart attacks or clogged arteries. But it doesn't always start with chest pain. Sometimes it starts with something much quieter, like feeling constantly drained. 1. How? Your heart and energy are connected. Your heart is a pump. It sends blood and oxygen to every corner of your body. But as we age, that pump may weaken. When it does, your muscles, your brain, even your lungs, they all start getting less fuel. You may not feel pain, but you'll feel tired. Tired. In your bones. The kind of tired that doesn't go away with a nap. This is especially common in a condition called heart failure. That doesn't mean your heart stops. It means it's not pumping as strongly as it should. 2. Early signs. You shouldn't ignore here. S where it gets personal. If you're over 65 and you notice any of these, you used to mow the lawn or walk the dog, but now you're short of breath. Halfway through, you feel like you need to rest after doing simple things, showering, cooking, climbing stairs. You've gained weight, but it's mostly in your belly or ankles. That's fluid, not fat. You're waking up at night gasping, or needing extra pillows to sleep upright. These are not normal parts of aging. They're warning lights, and too many good men I've known ignored them. 3. Why men ignore fatigue, and why you shouldn't. Let us be honest. Men are taught to tough it out, to not complain, to keep going. But I'll say this as a man, and as a doctor, ignoring your fatigue doesn't make you strong, it makes you vulnerable. And the people who love you, they'd rather have you around than have you acting strong. 4. What you can do. Starting today, you don't need to become a doctor to protect yourself. Here are 3 steps you can take. Right now, pay attention to your patterns. Keep a simple journal. Note when you feel tired, what you were doing, how long it lasted. Ask for a full heart checkup. This includes blood tests, an EKG, and possibly an echocardiogram. Be clear with your doctor. I'm feeling more tired than usual, and I'm over 65. I want to check my heart. Don't accept you're just getting older as the only answer. Fatigue is not a diagnosis, it's a symptom. Keep asking questions until you get answers that make sense. 5. Words I've told my patients, and now I tell you. Aging isn't the end. It's your body inviting you to take better care of it. If you ignore your body's whispers, one day it'll start to scream. You're not weak for feeling tired. You're strong when you speak up about it. We call this holistic elderly care, not just treating symptoms, but understanding the person behind them. Looking at the full picture, your body, your heart, your life, because fatigue isn't just about energy. It's about how your heart is carrying you through life. Let me say something that not enough people hear once they reach a certain age. You still matter. You still deserve to feel strong. You still deserve a life that isn't defined by pain or exhaustion. And if lately, you've been brushing off your fatigue, telling yourself it's just age, I want you to stop just for a moment and ask yourself, what if it's not just tiredness? What if this is my chance to catch something early, before it catches me? You see, fatigue in older adults isn't always what it seems. Sometimes, it's simple: dehydration, stress, sleep. But sometimes, it's your heart. And if that's the case, you deserve to know. Because ignoring it, well, that's not being tough. That's taking a chance you don't need to take. Leonard came back to my clinic a few months later. He looked different. Eyes brighter, shoulders straighter. A quiet confidence in his voice. I'm still tired sometimes, he said, but now I know why, and I'm doing something about it. His grandson still wants to play catch. And this time Leonard said yes. This is what holistic elderly care looks like. Not just treating illness, but treating the whole person. Respecting your story, listening to your body, taking the signs seriously, and doing something before it's too late. That's what I want for you. That's what your family wants for you. And deep down, I know it's what you want for yourself. So here's what I ask of you. If you recognize yourself in this story, tell us, leave a comment. Let others know they're not alone. If you're struggling right now, speak up. We're in this together. And this channel is a safe place for you. And if this message touched something in you, share it. Not just for you, but for someone you love who might be feeling the same way, but hasn't found the words yet. Aging is not the end of your strength. It's the beginning of your deeper wisdom. Fatigue is not weakness. It's a signal, one that says, you're still here. You still have time, and you're still worth the care. So don't brush it off. Not this time. Because you're not done living yet.